Hello, Andrew Kolsky from StopMyOCD.com. Many people search the internet and they have a question. Is there a "Do I have OCD test"? Well, in a way, there is, and I'm going to share it with you now. My name is Andrew Kolsky, and I'm a licensed professional counselor. I have a practice specializing in OCD and anxiety treatment, and you can find out more about my practice and information on OCD at StopMyOCD.com. So let's talk about two things. We're going to talk about a test for obsessive compulsive disorder and a test for obsessive compulsive personality disorder, two different things. First, obsessive compulsive disorder. So for the "Do I have OCD test," what we're actually doing is we're going to look at the criteria for OCD as listed in the DSM manual. This is the actual diagnostic manual for OCD. So this is what your psychiatrist, your counselor, your doctor will look for if they're trying to determine whether you have OCD. Number one, OCD is an anxiety disorder. That's going to be different from OCPD, which we'll talk about in a minute. But OCD is an anxiety disorder and is defined by the following things. A, there's a presence of obsessions, compulsions, or both. Obsessions are defined by both recurrent and persistent thoughts, urges, or images that are experienced at some time during the disturbance as intrusive and unwanted, and that in most individuals caused marked anxiety or distress, and the individual attempts to ignore or suppress such thoughts, urges, or images, or to neutralize them with some other thought or action, such as by performing a compulsion. Compulsions are defined also by two things. One, repetitive behaviors like hand washing, ordering, checking, or mental acts like praying, accounting, repeating words silently that the individual feels driven to perform in response to an obsession or according to rules that must be applied rigidly. And the behaviors or mental acts are aimed at preventing or reducing anxiety or distress, or preventing some dreaded event or situation. However, these behaviors or mental acts are not connected in a realistic way with what they are designed to neutralize or prevent, or are clearly excessive. Part B of the definition is the obsessions or compulsions are time-consuming, taking more than 1 hour per day, or cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. And C, the obsessive compulsive symptoms are not attributable to the psychological effects of a substance such as a drug of abuse or a medication or another medical condition. And the disturbance is not better explained by the symptoms of another medical disorder. So that's obsessive compulsive disorder. So the main thing there is to recognize that you have obsessions that are thoughts that are against what you want to have. You don't want those thoughts, and you do compulsions to get rid of them. It's different from obsessive compulsive personality disorder. They sound the same, but they're different. Where obsessive compulsive disorder is an anxiety disorder, obsessive compulsive personality disorder is a personality disorder. And let's look at the definition. OCPD, or obsessive compulsive personality disorder, has a pervasive pattern of preoccupation with orderliness, perfectionism, and mental and interpersonal control at the expense of flexibility, openness, and efficiency, beginning by early adulthood and present in a variety of contexts, as indicated by 4 or more of the following. Number 1, is preoccupied with details, rules, lists, order, organization, or schedules to the extent that the major point of the activity is lost. Number 2, shows perfectionism that interferes with task completion, such as being unable to complete a project because his or her own overly strict standards are not met. Number 3, is excessively devoted to work and productivity to the exclusion of leisure activities and friendships not accounted for by obvious economic necessity. 4, is overconscientious, scrupulous, and inflexible about matters of morality, ethics, or values not accounted for by cultural or religious identification. 5, is unable to discard worn out or worthless objects even when they have no sentimental value. 6, is reluctant to delegate tasks or to work with others unless they submit to exactly his or her way of doing things. 7, adopts a miserly spending style towards both self and others. Money is viewed as something to be hoarded for future catastrophes. And 8, shows rigidity and stubbornness. Now, one of the main differences between OCD and OCPD is that, like I said, OCD is thoughts that you do not want to have because they disagree with your values. We call those ego dystonic. OCPD, you actually do want to have the thoughts. You think it's a good thing to have those thoughts. Those are called ego syntonic. They agree with your values, but in OCPD, it just goes too far. So those are the specific requirements for OCD or OCPD. So the Do I Have OCD test has now been laid out for you. If you feel that these things address a concern that you have, make sure you reach out to a qualified mental health counselor or someone who is qualified and trained to treat OCD. I ask that you please like and subscribe this video and subscribe to the channel. It helps us get the message out further. And we offer a free OCD support group at stopmyocd.com if you feel that you have some OCD or you want to learn more. Again, stopmyocd.com. Thank you for watching the video. We look forward to seeing you on future episodes.